Hi, I'm Maisie. I'm from Panoramic Associates, and welcome to our first episode in our video series, Public Health Spotlights. Today, I am joined by Director of Public Health at Birmingham City Council, Dr. Justin Varney.
Hi.
Hi. So Justin, tell us a little bit about yourself and how you became a Director of Public Health, and what does the role mean to you?
Sure. So I started my public health career training in London.
Yeah.
So I rotated through what was then primary care groups. So back in PCG days, before they came PCTs and CCGs and now ICSs. I spent time in the regional office for London.
Yeah.
Health Protection Agency as it was then. And then Barking and Dagenham. And I got my first consultant job in Barking and Dagenham as a joint consultant and assistant director of public health for children and young people's health between the PCT Council. Spent about 6 years there. And then in 2013, public health was thrown up in the air, moved around, and I got matched into a job at Public Health England, originally to be the consultant for children. They changed that role. So then I got moved to be the consultant for adults and older people, then became the national lead. I spent 6 years in Public Health England and then survived 5 restructures, but not the 6th.
Yeah.
So then went out and applied for various roles and was successful in securing Birmingham. And so I've been Director of Public Health in Birmingham since February 2019. And in essence, my role as a Director of Public Health is to protect and improve the health of the population of Birmingham's 1.2 million citizens. It is very much the art and the science. So some of this is around joint strategic needs assessments, DPH reports, how do we look at data? Some of it's about commissioning of services, and I have a budget about 100 million in the public health grant because I have one of the largest populations in the country. And then at the other end, there's what I would call the art, which is how we work in partnership with both within the council across the different bits of the organisation, with the NHS, and with the wider community and voluntary sector, and with citizens directly themselves. So no 2 days are the same.
Sure.
This is not a job where you can go, I do X, Y, and Z.
Yeah.
You know, Monday is very different from Tuesday, and they're completely different by the time we get to Friday.
And I guess why Birmingham?
So I think one of the things as a Director of Public Health is it's important to connect with the population you serve. So this wasn't the first Director of Public Health job I applied for. But what was interesting and what I learned through the interview process was how important it was to feel that connection to place. So when I came to do the interview for Birmingham, Director of Public Health interviews tend to have lots of components. And in Birmingham, it's kind of the technical AAC panel, which is a consultant panel, and then a member panel. And between the two, I went across the road to the Museum and Art Gallery, and there was an exhibition called Women in Protest. And on the very far wall of the gallery was a wall of knitted breasts.
Okay.
And in front of it was a multicultural group of young women from schools across the city talking about those breasts and what they meant to them. And that was the moment I was like, Birmingham is where I want to be. Birmingham is my city. This is my vibe. And I went back in the afternoon and apparently I aced the interview. So, and I think that's a really important thing to actually think about actually when you're applying for a job, and particularly if you're applying to be Director of Public Health, is how you connect with the population you serve. You know, when I took this job, I moved up to the city. I live in the city with my husband, and we moved up from London, and we were very fortunate because we don't have kids and stuff, so it's easy for us to go. But it is really important that I have quite a granular understanding of the city. I walk the streets, I interact with citizens. That is the population I serve. It's also the population I'm part of. Yeah. And I think that changes the way that you deliver the job.
That's certainly really, really important. Is there any sort of particular highlights that have stood out to you since being a Director of Public Health at Birmingham?
I think there's lots of stuff I'm really proud of. And I'm really proud, first of all, that we have such a vibrant and diverse team. I have one of the most diverse teams in the council. I've grown the team significantly since I came. And change the way we work. We're much more focused on communities, and we produce things like the community health profiles. You know, in a city of 1.2 million people, it's not good enough to just use the phrase BAME and go all ethnic people are the same. So here we've really drilled down and worked with communities to understand the differences, because our Nigerian community, our Ghanaian community, our Jamaican community have different health problems, different health challenges, and deserve the respect to be talked to separately.
And I guess that sort of leads me on to my next question. So obviously Birmingham is a very big city, hugely diverse, and this is a really big job. What are some of your biggest challenges, and how do you maintain your resilience through those?
Sure. So I think probably the biggest challenge is getting to sleep on time. And I say that slightly flippantly, but COVID is probably the most acute example of that. During the first wave, I was doing about 27 hours a week of live engagement. So live Q&As, I was doing phone-ins on the radio, I was on the TV, I was meeting community groups virtually, I was talking to staff. And that was on top of everything else that I was doing. And what I really learned through that period was your resilience requires you to eat 3 meals a day, take physical activity regularly, go to bed at a reasonable time, get up at a reasonable time, and really think intentionally about that. Because I think even though we're out of COVID now, the council is in financial challenges, lots of stress and pressure around that. We've just come through measles outbreak. These things don't stop. And one of the things I would say to anyone considering either a DPH job or coming into their first consultant role is one of the key things to think about is how do you maintain your resilience? How do you set up the routines in your day that help you? And the other top tip I would give people is how do you manage your diary? So I always have invested in administrative support. I protect my lunch breaks rigorously. I'm quite firm. Well, exactly. But you see, all the things we would tell other people to do, and then we don't do ourselves. And doctors are the worst for that. But it's a really important part of our self-care. Actually, is if you don't look after yourself, and if you think about the director of public health is the carer of the city. We are statutory independent advocate for the health of our population. If we don't look after ourselves, who's going to look after the population if we aren't there? And that's, particularly COVID taught us that. Actually, we are the last line of defence. And therefore, you've got to be healthy enough to be able to be that defence. And that's why investing in a bit of self-care is really important.
Thank you. No, that makes complete sense. And self-care should be the most important thing. And just going back to 2022 with the Commonwealth Games, did you have any sort of particular input in that? And to what extent were you involved in that?
Yeah, Commonwealth Games was really interesting. Obviously, I'd arrived in 2019. We had lots of plans on what we were going to do around legacy. We'd taken on the Games halfway through, which is something I think is really important to remind people. We didn't have the full kind of 8-year run-in that most cities do. And then COVID hit. So we not only delivered an amazing Games, but we did it off the back of COVID, which really, really kind of changed things. From a director of public health point of view, I was involved in all sorts of things. I learned a lot. So one of my big kind of early lessons was there are lots of time critical things, like when you dig up the ground to put in power cables for the stadium, has to happen about 4 years in advance of the Games actually happening. And there's a relatively small kind of 2-month window in which that has to happen. Otherwise, the entire build stuff goes out of kilter. So I learned a lot about kind of urban design, urban planning. We were involved from that perspective. And through the Peribar development, we were able to pilot some of our healthy planning toolkits, which are now moving into our local plan. There was a whole bit that the world never saw, which was health protection. And obviously off the back of COVID, that was working with what was UXA/PHE at the time, and the International Federation and the sporting bodies around testing of athletes, testing of visitors, what we were going to do if we had an outbreak. Birmingham, fortunately, is quite a sporty city. So we'd had between the first 2 waves of COVID, I think it was an international badminton tournament where we learned a lot about planes and athletes and COVID. So there was all of a health protection, and we ran a kind of health protection response all the way through working with UXA, PHE. And then the third element was the kind of health promotion and the health legacy of it. And what was brilliant with the Games is we were able to do things like we held a global summit on food system work. And we launched with the support of DFID and Food Foundation, Food Cities 2022, bringing together cities from Commonwealth nations from low-income countries to work with us on food system work, and we learned a lot from having them here and having them share. And that was done in the programme over the Games. There's stuff we did with arts and health, and that's led to a whole programme of work that wouldn't have arrived. And then we worked with sports and exercise medicine doctors to develop a whole series of resources to help people understand the unique benefits of different sports and health. So it was a lot.
And especially with added pressure of COVID as well.
Absolutely.
Yeah.
But it was a brilliant opportunity. And I think one of the things it kind of illustrates is public health is a strategic part of the council and a strategic part of the partnership. And if you're really kind of switched on to that, then you can pretty much connect with anything and make it public health and find an angle that you can leverage to improve the health of the population and protect them through what you do.
Public health is involved in everything really across the council, isn't it? So cool. And just sort of going back into the advice you would give to a consultant in public health, perhaps that wants to be a director of public health. As a director of public health that's been involved in multiple interviews, is there any particular tips or advice on how best to prepare you would give to a consultant in public health that would be interviewing for a DPH role?
Sure. So I think a couple of things I'd reflect on, both in terms of people coming for consultant interviews and coming for director of public health interviews. So I think the first one is do your research. Do read up annual public health reports from the previous director, joint strategic needs assessments, but also make sure you've walked the patch. Particularly when you get into elected member panels, they want to hear, they want to see that you understand the lived experience of citizens in the area you're applying for. The second is demonstrate how you've done things in the past that are relevant. One of my most frustrating questions that I ask at interview or I see at interview answered is something along the lines of, tell us how you've demonstrated your commitment to equality and diversity in practice. And what I often get is a kind of shopping list of, well, equality and diversity means we're talking about the protected characteristics, Not, here's an example, and I recognise there are multiple aspects of equality and diversity, but let me give you an example where I've worked with one particular community of identity and worked to co-produce a solution based on their needs, their perceptions, and their challenges. And I think you can look at the kind of interview questions you'll be asked because they're pretty standard because these are competency-based interviews. But I think what I see candidates struggle with is I did, this is who I work with, this is what the outcome was, and this is what the long-term impact was. And being able to do that in a concise and focused way, I think is a really important part of honing your interview skills.
Thank you, that's really helpful. And is there anything in particular that you wish you had known before becoming a DPH, or any particular skill that you wish you had developed that would help you now?
Yeah, so I think things I wish I'd known, I think one of the things that as you're a consultant or a trainee, really try and get exposure to the political process. Every council is slightly different. I'd spent time, I've only ever worked in unitaries. I've not worked in county councils yet. Every council has its own kind of particular processes. So whenever you get the opportunity to work with or in a council, but even if you're coming up to a job application or job interview process, watch virtually the videos of their cabinet meetings, of their full council meetings, because it did take me a little while just to understand the governance and the journey. So I think that is a skill that's worth developing. I think the other one that I would say that I was lucky because I had done a lot of this before I came to Birmingham is media training. Okay. Directors of public health don't normally take the spotlight. That's the role. That's the job of politicians. However, when there's an outbreak or when there's a COVID pandemic, you are suddenly in front of a camera, and you don't have time then to go and learn how to be really good on camera, how to get it out in one take, and how to process when you're being fired questions. And certainly when I started in the pandemic, I did a live telephone phone in for about an hour and a half every Tuesday morning on regional BBC radio. And there was no little ticker tape that told me what the next person was going to ask me, because that's not how it worked. It was literally, and Justin, let's go to Mrs. Smith from Longbridge. And Mrs. Smith would come on, and the questions went from, can I still have my cleaner? To, I always remember a lady who came on who said, I'm partially sighted, my husband is in a wheelchair, and my daughter has learning disabilities. And every week I go to Sainsbury's, and the lady at Sainsbury's takes my arm and we shop together. But she won't be able to take my arm because of social distancing. And now I don't know how I'm going to get my food. And I was like, I mean, I still find that quite emotional to tell as a story, because I did find it very emotional at the time. But it's only because I'd done a lot of media training I was able to operate in that space. So my top tip is, go and watch political meetings. And the second one is go and get some media training wherever you are now. Don't wait till the crisis to learn how to talk to the media. It's a really cool skill that all of us need to have. Thank
you. And then just sort of taking us on to our last point, really, future of public health. What does it look like to you? And what's a main challenge or any core challenges that you think will be prevalent in the future of public health?
So I think there are a couple of challenges for us that I'd highlight. I think the first one is value for money. Yeah. We are really fortunate in local government. Public health is a ring-fence grant, but that doesn't mean we get a pass on showing value for money and really sweating the assets and demonstrating every penny we spent, what do we get as an outcome? And I think we've been slow to do that in public health. We've got to be more honest about return on investment. If I can get someone moving to 150 minutes of physical activity a week, then I know I can reduce their blood pressure medication needs within 3 to 4 months, their diabetes risk within a year, but their cancer risk reduction will take over a decade. So let's not overpromise either. So I think that's kind of the current big thing that for us I think is important. I think looking longer term, operating in a multicultural society, public health, historically, we haven't been an area where there's loads of research and loads of evidence because we're not backed by pharma. There isn't the money there to fund it. And it's great to see some of the things NHR are doing now to fund public health research. But when we look at things like behaviour change theory, it's based on very white populations. When we look at the way we communicate guidelines, and just going back to physical activity, 150 minutes of moderate physical activity. Moderate's a deeply white British middle class word. Most of us would struggle to describe what does moderate physical activity mean. So I think actually looking a bit further forward in the future is how public health operates in the context of a much more granular understanding of our diverse communities, and how do we communicate, co-produce and collaborate with those communities, but also how do we look at our evidence base in a different way and go, actually, we need a new evidence base because the populations we serve now are so very, very different from when many of these research studies were done. Okay. And then have you got any sort of final words of wisdom to an aspiring DPH or final thoughts? Oh, final words of wisdom. I would say go for it. I think I love being a director of public health. There are some bits that are absolutely heartbreakingly challenging and exhausting and difficult and frustrating and all of those things, but that's true in any job. And I've been lucky enough to work at local, regional, national and international levels of the public health system, and every bit of that has its own frustrations, so it's not any different in local government. Some of the things that make it really brilliant are working with citizens. Actually, you can see in real time what you do makes a difference. And that's unusual. If you're in a national job, it's much harder to see that policy change. So I would say go for it. And recognize the space you're stepping into. Step into it intentionally. I have the huge privilege to serve a city of over 1 million people and lead a team who are passionate that what they do makes a difference to people's lives, and it enables them to live happier, healthier and longer lives. And at the heart, that's what being a DPH is about. And I think there's no greater honour actually at the moment in terms of your ability to make a difference, not just for today, but also for future generations as well. Thank you so much for your time today, Justin. It's been really, really wonderful, and thank you for your insight.
and your inspiration to aspiring DPHs. So thank you.